Hi, my name is Dr. Mary Kathleen Figaro. I'm an endocrinologist, and this is my thyroid channel. Today we'll be discussing supporting a family member who has Graves' disease. As you know, Graves' disease is an autoimmune disorder that causes the thyroid to make too much thyroid hormone, and that thyroid hormone has a lot of effects in the body. Typically, there are 3 treatments for Graves. They are methimazole, surgery, and radioactive iodine. We won't be discussing any of the treatments today, but we'll be discussing how, as a person who knows and who loves a person with Graves, you can help them to endure the disease, to overcome it, and to thrive. First, support is very important in Graves because it has physical, psychological, and emotional effects on health. Those with untreated Graves can develop palpitations, high heart rate, even heart failure. They can develop severe GI disease, rapid weight loss with weakness due to muscle mass loss. They can lose hair, they can see double, they can even have psychosis. So they need support. And if you love a person with Graves, one way to support them is to help them to have the best diet possible and to help them to maintain an exercise regimen. It's extremely hard if Graves is untreated to exercise because it so weakens muscles and it can cause severe muscle aches. But once Graves starts being treated, patients will rapidly gain weight because they'll have lost a lot of muscle mass and they'll gain back fat mass. And that is disastrous for your health, your metabolism, making your metabolism slower and making you more at risk for diseases like diabetes and heart disease. So, if you are supporting someone with Graves, one thing to think about is to help them increase their muscle mass and to gain back some of the muscle mass they've lost. Another thing is diet. So, although not everyone who has Graves has a problem with gluten or has celiac, often if Graves is being treated, if you can change your diet to include less glutinous foods and to increase the content of vegetables and fruits, then you can get an improvement in the smoothness of the thyroid level, the not needing to have a lot of dose changes quickly, and not having reversion back to hyperthyroidism once the methimazole is being decreased. Even if you're having radioactive iodine or surgery, it's important around surgery not to have inflammatory proteins in your blood, and you can lower that in a good percentage of people with Graves by lowering the intake of gluten. So to summarize, to avoid a flare of Graves and to avoid worsening reaction to treatment, lowering the gluten, improving the quality of the diet, and increasing muscle mass is important. In addition, the other support is emotional support. As you know, Graves can cause anxiety, irritability, and treatment. It can even cause depression once treated. So if you support somebody with Graves, remind them that the disease itself can be the cause of their psychological distress and help them to get an intervention such as talk therapy or cognitive behavioral therapy to help improve their function. Therapy that helps includes the cognitive behavioral therapy or dialectic behavioral therapy to help avoid anxiety related to high heart rates and other complications of Graves. In addition, if medication is appropriate, SSRIs or other classes of medications for depression and for anxiety can help improve the outcomes of Graves. Sleep is often a difficulty for people with Graves, and as you get treated, the sleep gets better, but early on, medication that helps improve sleep can also help by calming the mind and helping when patient wakes up for them to feel better. So in summary, people with Graves require great support. They require psychological and emotional support. They require physical support, and they require operational support when they need to get to the doctor and they need to get their medications. And if you love someone with Graves, letting them know how the disease can affect all aspects of their life and helping them to manage those changes will help them to survive and thrive. If you like the video, please press like down below, and if you'd like to subscribe to our channel, please do to hear more thyroid related videos.